obviously, since the pandemic, a lot of things have changed and a lot of things have remained the same. From the conversations you've been having with other organizations or with other marketing folks in other organizations, what do you feel like marketers are really struggling with now?
I think because everybody was isolated during the pandemic, it accelerated digital shopping and also changed expectations for channels of distribution. So certainly for healthcare, but across all industries, the call, click, or visit marketing mix and the channels of distribution, the expectations have changed. And in order to meet those expectations, marketers have to step over their traditional boundaries and spend a lot more time on the data side, because in order to fulfill on those distribution channels, you have to be able to follow the data and actually collect and use the data on each customer. So I know I'm talking to Kevin and what sorts of products and services you want.
Right, right. Well, certainly e-commerce for many marketers, if they're multi-channel marketers, they've got place-based and they've got pure digital, or they may be a pure play. And similarly in healthcare, right, it used to be very place-based, but certainly the pandemic has accelerated telehealth in many ways. So, some of your touch points as a healthcare organization have become virtual as well. Do you feel like the health industry has embraced that, or that the digital transformation is facing a lot of headwinds?
I think that there has been some progress and there's still a lot of headwinds, because all of healthcare is built for going into a clinic, bricks and mortar, sitting in front of a physician. And that's really what you and I and most of your listeners would expect. So changing the expectations and actually teaching an entire customer base how to consume healthcare in a different way, how to use a digital symptom checker, how to call a nurse online, when to use urgent care versus actually a full-on doctor's appointment. All of those things are changing. And in some ways, I think of it as the way the airlines had to retrain all of us. So you and I right now would never dream of booking an airline trip online. We wouldn't dream of we wouldn't dream of booking in person. We wouldn't dream of calling someplace to actually book a reservation. We wouldn't dream of checking in except online, but the airlines had to coach the entire public through that, and we're having to do the same thing with healthcare consumers.